Rojas, and I'm the CEO of TexProtects, and I'm just thrilled to be here today with you to have a conversation that is a long time coming, a very important conversation for our state and for the families in our state. We're super excited for you to be here for our Building Strong Extended Families virtual learning session today. And we want to be sure to mention that today is being sponsored by Casey Family Programs, who's a terrific partner and just a wonderful ally and partner to have in this space. So thank you to Casey Family Programs. Brianna, do you want to go to the next slide? Before we dive into the conversation, we wanted to share a little bit about TexProtects. And so I know many of you today already know about us because I see some familiar names, but some of you are new to us. So just a few moments about TexProtects. We're an organization that's been around for almost 20 years now, and we focus on state policy that strengthens families. And we work on that through a variety of different strategies. We have various networks that we convene, including the Child Protection Roundtable and the Prenatal to 3 Collaborative. We also have a prevention network, which if you're not part of, we would love for you to join. The Texas Prevention Network is a network of a couple hundred organizations that all focus on directly supporting families at the local level. And we are a learning community. We learn from each other online. And so if you're interested in being part of that, please put your name in the chat and your email address and specifically say that you'd like to join the network so we can go back and add you into our roster. Over the years, we have passed quite a few bills and brought a lot of funding to the state related to supporting families, especially for home visiting. So a little bit about us today, and we're just really excited to convene this critical conversation. Brianna, if you want to go to the next slide. That's pretty much the first, I've been CEO for almost a year now, and pretty much the first week I started, I sat down individually with each person on the team, and Carrie, our Director of Policy Advocacy, in our very first conversation, said to me that informal kinship was something that we needed to focus on. And from day one that we met, she has prioritized this. So I just am really grateful to Carrie to elevating the issue. It's because of many of you in the room raising your voices to help us understand how important this topic is. So we're really grateful for Carrie's voice, but we're also grateful for each of you and your voices to help continue to represent families and their needs. So I'm going to turn it over to Carrie now, who's going to lay out kinship a little bit more before we hear from our wonderful panelists today.
Thanks, Adriana. And she's totally right. I've been talking to her about it since day one. So I know she kind of already introduced me, but again, I'm Carrie Giudice. I'm the Director of Policy and Advocacy at TexProtects. I've really been working in the child welfare space for about 16 years in several different capacities, but I've always been focused on kids and families because that's really where my passion is. I really am very giddy about this conversation today because I really think y'all are going to love hearing from this amazing panel of experts. They've been the one to teach me all that I know. But before we get there, I think it's really important for us to spend a little bit of time on what we mean by kinship and some of the terms that are often used. And so let's kind of start with some definitions. So what do we mean by kinship? Simply put, we're talking about family and friends of the family. When kids are being cared for by family or friends of the family, that is what we're referring to as kinship care or a kinship placement. You also may hear people use a shorter term kin, or one that you really, guys, you will only hear this in the child welfare space is fictive kin. I know that probably sounds weird. It sounds like we're kind of saying there's this like fictive kin that makes it seem like they're made up or something, but it's not that. I'm not the one that made up the term, but it's referred to. So fictive kin is the same thing as friends of the family. It's somebody that has a close relationship with the child and the family. So Brianna, if you go ahead and go to that next slide. Maybe a lag. There we go. So what do we know about kinship, and why do we focus on it? Well, it's because there's a lot of research out there, y'all, that shows that placement with kin is good for kids. And our friends and sponsor, Casey Family Programs, has put out a lot of resources on this. When kids can't be in the home of a parent, placement with kin, when it's safe to do so, is really the next best option. There are lots of benefits, like there's a better chance of being able to remain with siblings and maintain that familial bond and culture. It's usually a setting and a person that's familiar to the child, which provides some stability, but it's also far less traumatic whenever there's that trauma of separation. And then there's also, of course, we see over time that there are better behavioral outcomes for kids. And these are just a few. There's tons of research out there, but it really does show that this is a best practice. Go ahead and go to that. Oh, you already did. So I do want us to spend some time with some other terminology that you're going to hear. It's formal and informal. So Adriana kind of already introduced this idea of informal kinship. We're going to break down the difference of what we mean with each of those terms. I really think the easiest way for us to think about the difference has to do with who has legal custody. If the state has legal custody when the child is placed with the family or friends of the family, that's what is called as formal kinship placement. And there are just generally more supports for formal kin placement because the state has custody. For instance, there's an option to become licensed, which can provide a lot of different kinds of supports for the family. And they're eligible for compensation to help meet the needs of the child in their home. Go ahead and go to that next slide. I think it's the timeline. There we go. Yeah. So this is a timeline of what it has looked like in Texas over the years of those benefits for formal kinship placements. You can see more support has happened over time. I can actually remember back to a time when formal kinship didn't get any sort of benefits. There wasn't any sort of financial compensation. And it was back in like 2005 where the legislature finally it approved for like a one-time stipend for the children in their home. But Tex for Tex actually was really involved back in 2017 in the 85th legislative session. And we were the ones that helped advocate for better compensation on a monthly basis. So actually what is in place at this very moment in statute is that formal kinship caregivers can receive up to half of what a licensed foster parent would receive. And then this past session, we saw again some additional things being done for kinship. So we saw that the legislature actually approved an additional $6 million to basically help for concrete needs for kinship caregivers, and also had approved basically up to $750 reimbursement for those kinship caregivers that want to take the step to become licensed. And if any of you have kind of been in these spaces and heard different advocates talk, you've probably heard about foster care rate modernization. There's T3C. We love our acronyms over here, but basically what that is about is better compensating all foster licensed placements, and ultimately kinship benefit from that, even if they're not licensed. And so if you're kind of thinking about some figures, basically because of that rate modernization, even unlicensed kinship caregivers can receive up to $600 a month. I think it's around $600 a month, whereas up until recently, it's been like $386. So it is a good thing to move in that direction. So, okay, so that's kind of the formal space. Again, that's when the state has custody. There's different ways that caregivers can get those kind of benefits. There's more financial benefits there. But while we have kind of been primarily in that formal space, we want to build off of the momentum you saw on that last timeline slide. And we want to better support kinship caregivers even when the state doesn't have custody. We see supporting kinship as a prevention strategy to keep kids from coming into care. And this is known as informal kinship, which is when the state doesn't have legal custody. This could be placement of a child with a grandmother when there's absolutely no CPS involvement. It could be placement with a grandmother or aunt or uncle or whoever, neighbor, friend of the family, remember? So it could be that maybe there's an open investigation or a family preservation kind of case. But essentially, that child has not been formally and legally removed by the state. In these circumstances, there is no option for licensure. And you'll hear from our panel in a little bit about the additional needs and barriers specifically for informal kin. So this next slide, I want you guys to see just so y'all can kind of understand a little bit of the prevalence, or at least what we know. This is a stat that's actually from Generations United from 2021. For every one kid in formal kin placement, there are 24 in informal kinship placements in Texas. And that's just what we know. I honestly think that this ratio is probably larger, but this is just what has been captured. All right, so now the fun part, y'all. We're going to talk with some really great informal kinship caregivers that have a wealth of knowledge and experience to share with you guys today. They have been wonderful partners in this work. I've learned so much from them, and I'm excited that our audience gets to learn from them as well. So real quick, though, before we move forward and have them introduce themselves, for anyone that maybe has questions, we are going to save questions till the end from the audience. If you want to drop questions in the chat, please feel free to, and we'll get to those at the end. Just wanted to kind of let you guys know that we're hoping to have some time at the end for you guys to chime in. But I'm going to allow each of the panelists today to introduce themselves. We have a lot of ground to cover, so can each of you briefly, what I would like for you guys to do is share who you are and how you're connected to this topic personally and professionally. Mercedes, will you start for us?
Thank you, Carrie. And yes, my name is Mercedes Bristol, and I am a grandmother who adopted 5 grandchildren 13 years ago, and have now formed a nonprofit to help grandparents who are raising grandchildren.
Great. Chantel?
Hi, Chantel Bedlington. I am with ACH, Child and Family Services. We're one of the 4 pilot programs for the Kinship Navigator, which I'm going to explain a little bit more later, but that's a Texas state pilot program through Prevention and Intervention. And then I'm also was a kinship caregiver for several years, a very informal, what Carrie was explaining as informal kinship caregiver. We were maybe what you might have heard of as a diverted kinship caregiver. We were called for my niece and nephew to pick them up in lieu of them going into foster care, for a family member to come and take them on, so that they did not go into the foster care system. And so we were that very informal, diverted kinship caregivers for several years.
And thank you, Chantel, for introducing another term to our audience. Again, we use so many terms, kind of just, we interchange them. Beth, can you introduce yourself?
My name is Beth Maywald. I am a 30-year retired educator where I worked in early childhood, a large part of that. I retired and went to work for the North Texas Area United Way, where I work under the Texas Home Visiting Grant, facilitate our early childhood coalition. So I've worked with a lot of local services and organizations serving families. And 2 years ago, this Monday, Labor Day weekend, I took on my husband and I, kids came to spend the weekend with us, and we've had them ever since. So long story behind that, but yeah.
Thank you for sharing. I think you guys now can see why we have these 3 folks on our panel. They're not just talking the talk, they are walking the walk. And so I think I'd like us to start with, and again, we've got all kinds of different things that we want to chat about today, but Mercedes, will you start us off by talking to our audience about your organization and how y'all support grandparents raising grandchildren? Oh, did Mercedes drop off?
Technology challenged.
Oh, there we go. Hey, we're used to those around here.
The mute button. So So as I was saying, I run a nonprofit called Texas Grandparents Raising Grandchildren, and we created that organization. I've been doing the work for 10 years, but it became a nonprofit in 2019 after knowing that there's so many grandparents out there, and just people wanted to support the work that I was doing. So we now have served over 2,000 grandparents here in Texas that have come to us. Most 7 out of 10 of those kinship caregivers are informal, and maybe 2% are fighting through the system and trying to get custody of the children. And one of the things that we do is we provide case management and support groups throughout. We have one in Austin, in Houston, Dallas, Fort Worth, and around the surrounding counties here from Bexar County. So that's what we do. We have 3 major events a year, and that is we have our annual picnic coming up in September, and then we have a luncheon in December and a conference to teach grandparents how to take care of themselves and how to navigate some of the system that is so hard to acquire benefits for.
Can maybe you expand on this, working with so many grandparents, especially those informal kinship caregivers? What are the unique needs? Like talk to our audience about, and I know you and I have had this conversation a lot, but like what is so unique about this? Like when we talk about formal kin, where the state's involved, but what makes this like informal kinship caregiver and placement with the child in their home unique?
Well, what makes it unique is that a lot of times these children are placed there without CPS, just because the parents are incarcerated or parents can't be found. They just drop off the children, and so there's no CPS involvement. Other times they open an investigation case and then they place the child with a family member or a fictive kin. They put them somewhere and then they close the case because there's no evidence of abuse or neglect. So now they consider the child being safe, and there's no state does not take possession of the children. So it now becomes an informal kinship situation. And one of the biggest obstacle is the legal part, because once they're placed there, they don't have legal status on these children. So it's very difficult for them to enroll them in school, get immunizations, or any medical treatment whatsoever.
Gotcha. Thanks for making that connection there, because again, with that legal custody piece, when the state has custody, right, like there's just some different dynamics there, and obviously makes this a little bit unique for those informal caregivers. So I'm going to open this up. Let's maybe start kind of on the positive side of things. So I'd love for each of you to be able to talk about, well, we'll definitely get to challenges, but I'd love to hear what y'all have found to be the greatest support you found for yourself and for the kids in your home. Beth, will you start us off on that one?
Yes. I have to say, I've been very blessed to my connections in the community. I also, not going to the negative side, but I will always make the statement there, though, that this is why I'm very concerned about the situation, is because I know that families I work with, that we work with in our professional organizations, often don't have those connections that I have as an educator and somebody working with them. So just as a preference, the organizations that are in our coalition, as soon as they found out that I had taken on these kids and I started making phone calls, they were fabulous. I had 2, but my kids when we got them were 7 months to 7 years, 5 of them. And we immediately needed childcare. Immediately the next morning needed childcare. I made a phone call to our childcare partners. Not only did they tell me come right that minute, bring the kids, let's get them enrolled, but they made sure to give me the financial scholarships, even though my husband and I didn't qualify for them, their mother qualified for them. And so they went ahead and did that. And so that was a huge relief to me because my worry was, how am I going to go to work and know these kids are safe? Getting the kids into school. Fortunately, it happened over Labor Day weekend, so the kids had just been enrolled in school. It also just so happens that, of course, I was the early childhood coordinator for the school district for 9 years, and so all of the campus administrators knew me. So I was able to go in and say, here's my situation. I don't have a birth certificate. I don't have a social security number. I don't have anything. I don't have anything that says what I can do, but I'll be bringing these kids to school, and what do I need to do? And so that was a huge blessing within the school district, doctor's offices. Also, I need to mention that my second grandson was born. He's legally blind. His optic nerves did not develop, and he has a cortical dysplasia issue. So he sees a lot of specialists at Cook's in the Dallas area. So navigating the medical part was huge because I didn't want him to miss anything, and come to find out he had already missed about a year worth of some things he should not have missed because mom and dad did not do it. And so the medical, that was a little more hairier, but their pediatrician here in town got on the phone and helped us say, this is who's going to be bringing them. This is who has the kids in their physical custody, even though we didn't have a piece of paper that told us that we could do anything. So I would have to say those are the things that immediately helped. And then friends and family, because our other issue was we immediately had to buy clothes, school supplies, and toys for 5 kids because their mother was involved in drug situation and had moved drug dealer and drug people into the home. So when we were able to get into the home to try to get the children's things, I wouldn't take any of them because we found used needles and we found things, and I was scared to take anything. So we just abandoned all of their things. So we had to start from scratch with 5 kids. So the initial financial investment was huge. And getting everything replaced, getting them into the doctors, doing all of those things.
Yeah. So what I'm hearing, I hear a theme of the community you have around you, the connections you have, and what's available in your community plays such an important role. And like you said, you kind of started out with the words like, I feel very blessed. So it sounds like, it's going to be somebody's situation may be very dependent again on what that social connections look like and what's available in the communities as far as supports. Thank you for sharing that. Yeah. Chantel, will you add to this conversation?
Yeah, I would say one of the things that I'm really grateful for in the Kinship Navigator program is that it is a strength-based intervention. And so we are focusing on family strengths. And I will say on a personal level, I've been a foster parent, I've been an adoptive parent, and I've been a kinship parent. And talk about the unique difference as being a kinship parent. Only in one of those situations did I ever have a bio mom show up at my house on Christmas morning. Kinship, right? That doesn't happen in foster care, that doesn't happen in adoption. But it's family. And that's what's really beautiful about it. That's why these numbers are so high. Because family takes care of family. And when we got that call to for a niece and nephew, what was going to happen, what were we going to do? What does family say? Family says yes. And so we always can build on that there's a reason that we're doing this. And family takes care of family, and family steps up when they don't have the money, when they don't have the space, when they don't know how they're going to make it work. Family says yes. And I think that's a unique and beautiful, support and gift that these families have. And then the other thing I'll say is, that 24 informal for every 1 formal in Texas. That's based on 2020 census data. So we know that number's low because it's old. It's an old number. We know it's low because we know lots of populations are undercounted in census data. And we're really seeing, obviously, because the vast majority of those are informal families, like Mercedes said, they need a lot of legal support. And we're really seeing some organizations really step up to provide some legal support. And so I'll say one of the biggest supports for families for us right now is Texas Legal Service Center. They have a kin care attorney. They're doing kin care work, really focused on this. And so we're starting to see some of that pop up. And like you said, community resources, that's that's where the connections happen.
Yeah, and thanks so much for, I think you highlighted something, you know, that I feel like we talk about a lot in this space about how families, like you said, we say yes. You say yes, even if you know, like, oh gosh, I don't have all the means to be able to do this, or you may not even know, right? You may not even know what all you're going to need to be able to do, and so that's why it's so important to make sure that you have the financial resources that you need, to make sure you have the connections that you need. Thanks for highlighting that. Mercedes, do you have anything to add?
Everything you guys said was right on. The only thing I would like to add is that my doctor was very instrumental when I got the kids, and I actually got sick. And so the stress was very high, and so I went to see my doctor, and so he gave me a greatest resource, which he sent me to Al-Anon. And Al-Anon was a great program for me. And for those that don't know, that is for any relative or friend or anybody that's associated with somebody that's going through any kind of addiction. So because of the opioids that the parents were doing, I didn't know how to handle the whole situation, and I was still trying to get the parents to be parents. And so what that program taught me is that, you know, I can only take care of myself. So I think the awareness of just taking care of me and the children was very beneficial from the beginning. And then again, you know, the family support, and then the school was another instrumental piece in my life, because they were able to identify that my grandkids had some learning disabilities. And then I was educated on ADHD and PTSD and oppositional defiance and all of these things. So I think what I received was a lot of education from the beginning on how to navigate this new situation I found myself in. And so that was very, very helpful for me.
Thanks, Mercedes. And you all have kind of highlighted some form, whether it's like formal or informal, of like these navigators, right? Like that, you know, it's so helpful. Again, those connections and people that know what exists, and you've got somebody that's knowledgeable, that's able to kind of give you a referral where you need to go. So I appreciate that y'all all are highlighting just how important that piece is. And again, your circumstances could be dictated if those aren't strong in your area, right? If you don't have those connections and things like that. So, you know, you guys have already kind of elevated some of the needs, and I love, as advocates, y'all have already been kind of sprinkling some resources to our audience in true form, all three of you. But I would love for us to kind of switch gears and talk a little bit more about what the prevalent needs are, and where you go to help. And I think, again, I think y'all have already kind of highlighted some of that, like childcare, the medical piece, legal and financial, which, Mercedes, I literally feel like I always have you in my ear talking about the legal and financial aspect of supporting informal kin. Is there anything else that maybe y'all haven't talked about yet that y'all want to elevate? Again, what the prevalent needs either that y'all have faced or that you're hearing from folks that you're working with. Chantel, will you start us?
Yes, I mean, yes, clearly we've talked about basic needs, we've talked about legal, those continue to be at the very top of the list. And I think I do want to highlight, because we're talking about primarily grandparents raising grandchildren. It is the vast majority. And the census data shows us that, the KNP work data that's being collected shows us that. And so you're primarily talking about people on a fixed income. But then, you know, also connection to state services. We have amazing state services like SNAP benefits and TANF benefits. But when kinship caregivers can't access those, and we have other states that have, you know, different levels of TANF care for grandparents or for kinship caregivers raising grandchildren. In Texas here, we just have a $1,000 grant, and it kind of stops there. And so some changes in TANF supports and state services, the ability to get state services. Again, a grandparent who's placed with 5 grandchildren, who has a home paid for and a car paid for because they were in retirement, and now they can't qualify for services because those items count towards their income. That makes a huge difference. And then the other thing I'd say is trauma support. We forget that kids are in informal kinship placements too because of trauma. Um, we were blind. I mean, I'll say, as former foster parents and adoptive parents, we expected trauma. In your family, you go in kind of blind, and these children are not in the situation that they're in without there being a huge level of trauma. And for the caregiver as well, again, you're talking about that family situation, the family dynamic, and the guilt and the shame, and all of the things. And so real trauma support and mental health support for these families, I think, is a huge need. And we know that's, something that we don't have enough of all across the state of Texas. So.
No, that's great. Beth, do you have anything to add?
Well, I just want to reiterate what Chantel just said about mental health. That was the first thing that came to my mind with your question. Immediately, I had to get my two oldest ones into counseling immediately, because the 7-year-old had been taking care of everybody else for about 2 months. Yeah, I work from home. Bye. We've already said legal, but to me, for the first 9 months, I needed a piece of paper that gave me the authority to do something. And that is the legal framework, and I know it, but that takes a lot of time. And I know we can talk about that later, but that was, Mom said she would sign guardianship paperwork just to give me a little bit of leeway. She did not do it until we had the kids for 7 months, and a CPS case was filed against her, not because of these children, because we had her children, but she was babysitting a boyfriend's children, and CPS got to have a case. And when that happened, CPS made her go sign a guardianship paper. So that's what comes to mind.
So I do want us to spend a little bit of time talking about the legal needs. And Beth, I know I was having trouble hearing you. It's no fault of your own for a second, but I do want to make sure that we stay on this. I actually would love for you and Mercedes to both talk about that legal aspect, because like you were talking about how there's just different things that, you may need to file for or do, like to be able to make decisions. And when you don't have that legal authority, it kind of sounds like that adds to obviously the challenges of caring for the kids in your home. So talk to me a little bit more about that, like what that experience has been like for you, and what the barriers have been in that process.
Okay, well, for us, when we initially took the kids, we didn't have, I don't know my wording. We didn't immediately go seek an attorney and go file for custody of them, because we really were trying to figure out the situation. The father of these kids was adopted. We adopted him, and he had a lot of problems, bipolar, ADHD, all kinds of problems that we dealt with as he was growing up. And to be honest with you, kind of what happened with him is we knew he was a drug addict. So we were trying to support Mom. And we were already keeping Mom in a very nice 3-bedroom home with her children, trying to get our son to seek help. They separated and then eventually divorced. But what happened was Mom turned to drugs and brought it into her home with the children. And so when that happened, when we did not have the knowledge of it happening at the time until she asked us to keep the kids and so forth. So our first status was we had no legal finding anything to do anything with, as I already mentioned. And the only way for us to get that was to go to an attorney and file a suit against Mom. Well, we too, Mercedes, we're still in the mindset of we want to help these parents overcome their addictions, and we want to help these parents learn to be good parents. So we were throwing a lot of money and effort at that while trying to take care of these children. And it took us about 9 months. We even let Mom move in with us for a brief period of time when we thought she was clean and she was doing a sober living program. So we let her move in with us. That did not work out well at all. immediately that didn't work out. And so then we finally had to take a stand and say, okay, for the emotional well-being of these children and of ourselves, we've got to take a stand somewhere. And so at that point in time, we just told mom no more. And we went to an attorney. Of course, that's a whole nother ball game of money that we had to pay up front to get an attorney to represent us. And we did not get a temporary hearing until last August. So we had the kids from September until August before we got a temporary hearing to actually get custody of them. When we actually got temporary custody of them, that was the first legal paperwork that we ever had in that whole 11 months that we had the kids that said, okay, you are authorized to really do these things. Before that time, we were going through the back door to do things. I couldn't even get their birth certificates. The child care actually got their birth certificates for me, which I thought was totally insane that I couldn't walk in and ask for their birth certificates, but the child care could, it was really weird that, so did that answer your question, Carrie?
It does. I mean, you're just talking about your experience with that legal process. So I appreciate you sharing that with our audience, because you hit on a few different things. You talked about just in general, like just as family, when you're talking about family, just the dynamics that come in, because you're going like, hold on, I don't really want to do this, but need to be able to make decisions. And it's not an easy decision to come to, right? But then also you highlighted the issues just even in the legal process, the amount of time things can take, the financial aspect of it being that kind of additional challenges for you guys. So I appreciate that. Mercedes, I know you and I have had a lot of conversation over the years. It's not necessarily, or at least this is my understanding, so please talk to our audience about this. It's my understanding that it's not necessarily that there aren't legal pathways, right? It's more of the steps and the process that are the challenge. Can you talk to our audience a little bit about that, Mercedes?
Absolutely. So one of the things that came to mind when Beth was talking was, she had the financial capability of paying for all of those legal things that she talked about. Again, about 8 out of 10 of our grandparents that come to us, they don't have that. They're on fixed income, like Chantel said. They're on Social Security, and now they have 4 or 5, children. So that in itself, it's to me is inequitable, right? We just don't see that in the big picture, that some of these grandparents can't do that. So one of the things that you and I have talked about is, these non-parent authorization forms. How can we get grandparents to get some kind of status? And we've been speaking to Texas Legal Services and different state representatives and seeing how we can implement, Chapter 34 that is in the HHSC handbook, or the DFPS handbook, is a non-parent authorization form. And that is sometimes we're trying to see how can we get parents to sign that, but that is just like a power of attorney. It could be revoked at any time. So then we were looking at Chapter 35, which needs to go through the court system. And so now we need to get, the parents served or acknowledge that they get the notice that it's going to court. And then the judge can actually grant 1 year of a non-parent authorization form. So we've been trying to see how can we go around this huge expense because most of our grandparents don't have the money to pay for these attorneys. So, or they have the kids for years and with no paperwork, and we get a lot of grandparents again that come to us and say, I can't even take my grandkid to get their immunizations. So last month we had a grandmother that came in, and she was talking about her grandson, 14 years old, had a concussion. Took him to the ER, and they hooked him up, and they tried to triage him, and then they went for the registration, and they found out that she didn't have legal custody, so they let him go home. they took them off the IV and let them go home. And I'm like, how could they do that to these children? So those are stories that we hear. These are the back end things that are very difficult to hear. And going back to Chantel, how do we get the state or the to be able to transfer those benefits that those children are getting already? How hard it is, when they're receiving TANF or SNAP, and the parents don't want to relinquish the rights to that. And so you can't go, you apply for them, but then they tell them, the benefits are already active for those children. So now the grandparents don't qualify. I know that's been a big burden for some of these grandparents to get the benefits either transferred or apply on their own because of the custody issue.
Okay. So, I mean, I've heard y'all highlight a lot of different things and again, I think what each of you have talked about is, again, like, just as a reminder of like who this impacts, right? Like, caregivers not being able to access certain things or for the child, like that ultimately impacts the child. And another thing too, so just to kind of go back a little bit to the legal aspect. So what we heard Beth talk about, just for some terminology for our audience, what Beth was talking about in regards to filing a suit, that's what's called, again, we love our acronyms, a SAPSR, so a suit affecting the parent-child relationship, which is it is a pretty lengthy process. And Mercedes, you talked about that Chapter 35 authorization, both of which, these options require, my understanding is they require, like you said, service, like you have to actually serve the family. There can be different fees associated, whether you're talking about like the attorney fees, whether you're talking about the court fees, whether you're talking about just even the fees to serve, or like even potentially even establish. I've heard different things about having to establish paternity at times. Like all of those are fees that end up mounting, kind of just stacking up for caregivers. So I appreciate y'all just kind of talking about that financial aspect. Do any of you have thoughts about how to kind of tackle that? Like, how do we, have y'all seen any sort of innovative things, whether that's in your communities, or heard of just different ways to be able to help with that financial aspect for caregivers?
Carrie, I have found nothing in my community that would financially help because we are not going through the CPS. And fortunately, my husband and I took money out of our retirement accounts. That's how we paid for our attorney. That's how we paid for an $8,000 unexpected childcare bill in the first year. Those things. And Mercedes is so right. That's my concern in the world that I work in, is I know that the majority of the people in my situation don't have access to get that help. One side note to what you said a minute ago, we all talked about benefits like SNAP benefits, Medicaid, those things. We were fortunate in that the judge that we had at our temporary hearing mandated her to keep those things in effect, so that currently our children are under Medicaid. Currently, she gets $1,379 a month in food stamps. And because she's had another child with someone else since we took these 5. And so she has 6 children. And he mandated her to give us the card. From talking to our attorney, she received 8 days a month of visitation on Saturdays and Sunday. So we split the card with her because I wanted to make sure that these children were fed, had food at her home. And so that's where we are currently. But my next concern is when we have our final hearing, and we don't know how things will go. The judge may give the kids back to her, but if the final hearing turns out that we keep primary custody of these kids, then we're going to lose the SNAP benefits. We're going to lose the Medicaid. We're going to lose the ability to have those scholarship opportunities with reduced childcare and those kind of things. And so we've already sat down and put paper, pen to paper, and we've already figured out then we're gonna need another $1,500, $2,000 a month to cover those expenses. You know, and we are both, my husband and I are both retired and have both gone back to work at another job. So, you know, but we additionally take care of my mother and his mother. So, funds are limited, nothing like, of course, others think. So that's a concern for me is, you know, what happens when we do get full custody of them? There's no help. There is no help.
Mercedes.
Oh, no, I'm sorry.
Just chimed in. Chantel, is that you?
It is.
Go for it.
No, I was just going to say, I think it's important too that we remember that some of these children, you know, even when we can go through TLSC or the AG's office for child support to try and get that SAPSER, some of a lot of these children, we've run into it quite a lot, don't have any documentation. They never got a birth certificate. They never got a social security number. They're invisible. And that becomes really, really difficult when you're trying to find someone to serve. And so, you know, that's just another layer of, you know, this legal problem that these families face and that we have with these kids. And then, you know, education, I just want to say too, because that is a legal issue. Getting these kids educational services. I know for my niece and nephew, it was 2 weeks before we finally got them into public education. Because without the documentation and you know, you kind of have to fight with the school district to get enrollment because they're not technically homeless children, though you have to fight the fight of they are displaced children. And I've gone back and forth with TEA on that and finally been able to stand, you know, on the ground and saying, okay, yeah, we can understand where these are displaced children and to get those services. But even that's been, you know, a little bit of a round and round because there's nothing, you know, we have McKinney-Vento liaisons, we have foster care liaisons in our public schools. There's nothing for these children. They're so undefined.
That's a really good point. I'm glad you're bringing that up. And gosh, I just have to say this out loud, as you guys are all kind of sharing, obviously from like your own personal perspective and your own experiences. Gosh, you guys are such fierce advocates for these kids in your home. And just, yeah, I mean, y'all are just showing, you know, just the commitment that is needed and, you know, just how you, like, as a caregiver have to be such an advocate for yourselves and the kids in your home. And there's just, it's very complex and there's a lot of hurdles that you have to jump over. So Chantel, I'm actually going to go ahead and pivot here. I want to give you an opportunity to talk about what Texas is doing to support kinship caregivers. And I'm going to go ahead and kind of ask you too, if you don't mind, I'd love for you to talk about the pilots that you mentioned, the Kinship Navigator pilots. But can you also maybe help tie in some of these needs, how those pilots are or maybe aren't able to meet some of the needs that we've talked about today?
Sure. Yes, I will do my best to do all of those things. All right. Yeah. So we are a pilot program for the state of Texas, funded through, you know, prevention services funding through DFPS and prevention early intervention. So that's how we're funded. And when I say prevention, FFPSA, Family First Prevention Services Act, I think is what that's called. Grant money that was given to states for programs such as these. And so Texas is on our 4th year of implementation through 4 pilot programs, and that's ACH here in Fort Worth, DePelchin in the Houston area, New Horizons in Abilene, and Catholic Charities in Lubbock. And so what is unique about Texas, and again, lots of states have different ways in which they allocate things like TANF funding, right? And so there are states that are doing things for informal care in how they find families and how they serve families through TANF funding and things like that. But in regards to kinship navigator programs, Texas is really unique in being one of the few and rarer states that is really creating a kinship navigator program that caters to informal kinship care. So those families either that were never touched by Child Protective Services or that were placed through family-based safety services, parent-child safety plans that don't have a formal caseworker. And as such are not able to be licensed and verified as formal kinship family homes. And so what those programs are doing that's kind of very similar across the board for all of us is in-home case management services for kinship families. And that is kind of a jack of all trades across all the organizations. We might be meeting with families to help them do, TBRI, trauma-based relational intervention with their families. Here at ACH, we are TBRI trained. We're motivational interviewing, seeking safety, and a little bit of brief strategic family therapy. And so working with those families to do in-home support for their kids that they're serving, that's true across the board, whether we use different evidence-based practices, that's true across the board. And doing, everything, like I said, from budgeting, we've had a number of kinship caregivers. I can think of at least 3 off the top of my head where they were retired grandparents living in an RV, going to travel, and now they're placed with grandchildren living in the RV. So really kind of aligning our goals and our plans, setting goals, setting plans, talking about how, the world looks different, educationally, discipline, all of those things, just really kind of working and educating with family members. Programs across the board, meet with them once a month at least. Some families we meet with obviously weekly. And programs, I will say this, we just did a training this morning kind of talking about where we are so far in this program. And one of the numbers that I thought was really interesting was across the pilot programs, the families that we're serving, 49.4% of those kinship caregivers that we're serving have been placed with 4 or more children in their home. In addition to possibly the children already in their home, right? So I already had 3 children in my home when I went and picked up my niece and nephew. But 4 or more, that's almost 50%, 4 or more children placed in their home. And I just think that's, that's huge. That's worth pointing out. So like I said, we are wrapping up year 4 of implementation. Another statistic that was shared this morning is over half of those caregivers that we're serving in our programs are over the age of 50. And again, that's not super surprising. And across the programs, I don't know if we do a program experience survey and a protective factor survey, right? Those are state surveys that we get from DFPS that they have us give to our caregivers. And we have an over 90% success rate in our program experience surveys across the board for all 4 programs, and over 90% that see an increase in at least one protective factor. I'll say here at ACH, I know our last 2 quarters, we've had 100% for both of those surveys in the last 2 quarters. And so the work that's being done is valuable. And it's real, and it's connecting families to concrete supports. It's helping them connect to those state services. We're reapplying, we're, filing amendments, we're working to get those state services. It's connecting them to those legal supports and, providing very limited basic needs support when available. But the biggest part is community, connecting to grandparents raising grandchildren and support groups, and supports such as these. And so it's important. And right now, I think the future is a little uncertain. What happens with state funding, what happens when the pilot program is over, what happens with the federal dollars. And so I think that's important to note. I don't know what else you're wanting me to share, Gary.
One thing I'd like for you to maybe touch on is, how families find out about you guys. Like, what are you guys doing? Like, I know you've talked over time about like y'all's outreach, like how do folks, because we've talked so much in this conversation about connections and knowing who to call and all of those things. And so how do people find out? Like, and is it that different at each of the sites? What can you share?
So I think there are some slight differences between the sites. Like, I know Lubbock is really out in the community regularly. They're having events, they're doing, I am more, I will say for here at ACH, and we have we stay at about a 30-person wait list constantly. We're about 2 to 3 months out of service right now because the need is so much greater than our capacity currently. But I've connected to every one of our school districts. We have a community outreach person that goes to every single school district at the beginning of every year and meets with those McKinney-Vento and those counseling directors and liaisons. We're at our local hospitals doing presentations. We're connecting to local law enforcement and communities of faith communities within our area that already have adoption services or respite care nights, things like this that we're connecting to. And so the majority of people are connecting to us through those avenues. Again, the school districts being a huge one. But now I feel like the cat's out of the bag, right? Pandora's box is open and the word is spreading. And when we just get random, I heard about you through a friend of a grandmother who you served. So we're getting a lot really organically and grassroots that way. And I think that's, again, true amongst all the organizations. So how exactly, all don't have a community outreach organizer. That was really important, I thought, to our program. But everybody's kind of doing that work to connect kind of really, like I said, really grassroots efforts. And I think it's pretty true across most of those programs that they're feeling like, okay, the word is out. And now the numbers are coming and coming and coming. And what do we, how do we slow it? And is there such a way? And, I think, I don't know if you wanted me to share this right now, but I'm gonna, I think some of the things we've learned is that, there's so much we just don't know. I mean, even as we're talking today, I mean, every situation is just, ICPCs, it's different from every state. Every state, what the rules and requirements about licensure and how those families can be served are. So even with informal families, there's just so much we don't know. And then these informal and these diverted care families, I think the needs and the stories and the situations, there was just so much that we didn't know. And every time we think we have a handle on it about what it looks like, then, like I said, we have some hidden child who has zero documentation, and how are we possibly going to get this in front of a judge, kind of a situation. And so it just is ever changing because of what it is. And then state services just aren't catered to the elderly. And they're just not catered to elderly being able to access those services. They're not catered to retirement and like I said, their home paid for, their car paid for. It's just not catered to this kind of situation. We don't have anything in the state of Texas that's catered to this. And so that's some of the things that we kind of were unaware of when we started.
So I want to go back to something you said. Okay, so you talked about 30% wait list, 2 to 3 month wait list. And then you talked about how the cat's out of the bag. Now more people know about it. Therefore, more people, saying, hey, I need help. This is what I need, right?
Right.
So what I'm hearing is that there's more need, right? Like whether that's funding, whether that's expansion into other areas. Do you happen to know, so like you mentioned at the beginning, there's 4 of these and you all are doing fantastic work. Are there any conversations about whether it's expanding to new areas or extending the funding that's available in the 4 that currently exist?
For fiscal year 25, which starts in September, no, there have been no conversations in regards to that. I do know that there's been some talk about, federal funding and federal dollars and what expansion would look like. And I think there's been a lot of talk, from prevention and intervention about federal funding to expand these programs. But I know as of right now, without legislative change this session, that's not in the current cards.
Okay. Yeah, it's my understanding that the pilots you were talking about, so earlier you referenced Family First Prevention Services Act. So a lot of the things that have gone on through that route have been like temporary kind of solutions, not necessarily these long-term plans. And so my understanding, and correct me if I'm wrong, is that basically y'all's funding, at least like the Title 4B funding, is potentially, you know, winding down. And so there's need for there to be more permanent funding so y'all can continue to do the good work that you're doing, right?
Right, absolutely. Yeah, that's why I say our future is uncertain. We have an uncertain future, and and I can speak for all of the programs because we have met and we have talked. That is frightening, not because we're worried about our program, but because you're serving this vast majority of kinship caregivers, and the needs are great. I mean, the legal needs, the assistance, the needs are great. And, I will say kinship caregivers are amazing finders, right? They are going to figure it out. They're said yes and they're trying their best to figure it out. But without programs like these, they're on their own to figure it out. And when you're talking about a technology-driven world where everything's online, and what I say, 50% over the age of 50 kinship caregivers, I mean, it's just that the playing field isn't even.
And you mentioned so something I want to make sure that I'm understanding too is, so yes, we are in an information driven world where we can pick up our smartphones and look into things, but you're talking about this population, so you really need the warm handoff. Is that what you're kind of alluding to? You need that person that can kind of ask you the questions and say, okay, what is it that you need? And then they know what exists. Like, is that what you're kind of?
Absolutely. And it's one of the things being tracked by the state for the programs. They are all doing warm handoff referrals, and the state does call them that, warm handoff referrals, because, I think of my mother. If my mother had my children right now, is she going to get online and find, fill out that horrible Texas State Services application, or does she need somebody that she can call that says, you call Susie, she's going to do this with you? That's what they need. And, we talk about this program, and I say this all the time, we serve pollers. As you can imagine, I'm have children in my home. I'm a mother raising children around the age of my niece and nephew that we got. But the vast majority of our kinship caregivers are no longer have children in the home. And so they're experiencing like a life that they weren't planning for completely, right? Their future has changed. They didn't expect this. They didn't plan for it. They're parenting again, and on a fixed income. Or, we have those 20 somethings, those older siblings who are raising their siblings in their 20s. And again, all of their friends are living their life in their 20s. They don't have the financial means for this. We had a young man recently. He was the first in his family to go in college when his mother passed away. And so now he's trying to manage college and his 3 younger siblings and live that life. You were asked about a success story. It's actually the success story I was going to share. So I'll tell more about it later. But, that's what these families are experiencing. We just have these families that are in such dynamic polars on either end of the spectrum.
Interesting. Yeah. Well, I mean, I definitely hear what you were saying, and the fact that, again, all of the stories, all of the different things that y'all are doing definitely sounds like there is a need for these to continue. We'd love to see them in more than just the 4 areas, and that the 4 areas that are doing it are able to serve more families. If you could, I would love for you to share with our audience a success story, and then I will actually ask all of you a question. So if you could share, I know you wanted to share a story about y'all's kinship pilot.
Yeah, again, I think that when we talk about kinship, we often talk about the negatives, all the needs, all the things that are stacked up against them, and it's real and it's true. And let me just tell you, we had the means, and again, my children are of that age. It's not like I was in my 50s, 60s, 70s doing this, and it's still, I mean, it's not what you're planning for. It's not what you're expecting. It is overwhelming. But there are beautiful things that happen within this too. And I think it's important that we always highlight those when we talk about kinship, because it is about family. And I think that's important. And so we had this lovely young man in his 20s whose mother had died of cancer. And it happened really quickly. Within diagnosis to her passing was months, like 3 months. and first in his family to go to college, living in a small apartment. Even had he formally been placed, would not have qualified for licensure because he was too young. And because his place was not, would not have passed any kind of home studies, right? It was a small apartment, and now he's got his 3 younger siblings that he's caring for. And so just being able to work with that young man about figuring out, working with the school, connecting with the school, getting those kids some McKinney-Vento status so they could go to the district in which he lived and get transferred, even though he didn't have any of the documentation. Working with Texas Legal Service Center to help him walk the legal process and ultimately get conservatorship of his siblings. And, and really working with him and the school to work out plans and connections in his community and friends. How are you going to do school and this new life? And who's going to help? And what are the kids going to do after school? And how are they going to get there? And, what's going to happen? How long are they going to stay in after school care? And, all of those things, just really helping him figure out this new life and come to grips with it, come to terms with all the plans that he thought were going to be different. But also celebrate it in a way that it was, you get to keep your siblings together and they get to stay with you, and really just kind of focus on the beautiful things in that. And that young man did finish his well, let's see, what was this May? He finished, I think it was his freshman year of college. He did finish that semester, was able to continue to go on. He's enrolled again this semester. Like I said, we were able to get conservatorship. We were able to pay a couple of bills and help him get his car fixed because he was having some transportation troubles, and that was needed now with siblings. No longer could he ride public transportation and get everybody everywhere. And so we were able to really just help him focus on getting, a new perspective, and figuring out how to work with his community around him to, it takes a village. How was he going to find his village? Who was going to be his village, and how was he going to make it happen? And then, like I said, that legal support, and that was huge, and getting those state services as well.
That's awesome. Thank you so much for sharing that, because you're right. I mean, we absolutely need to focus on the needs and the challenges, right? But it's always heartwarming to just hear the good things that are coming out of the programs that you guys are doing. So I do want to ask one last question before we open it up to our audience. And I know this is going to be hard to ask y'all to do one thing, but obviously we all know that legislative session is coming up in January. It's going to be here before we know it. But what is one thing you want legislators to know about informal kinship and remember as they make decisions this session? Mercedes, can we start with you?
Yes. I think one thing that I would like to address is the financial. I think the financial is a big ask that we've been working with Senator Menendez and Josie Garcia and a lot of great legislators. And just to say that I testified on the House Bill 4 that you talked about earlier. Me and my grandkids were able to testify in 2017. And so I'll just continue to have that conversation and about financial assistance for these grandparents.
Beth, do you want to chime in here?
I'm the one that has trouble with one.
We all do. It's okay. What's your one if you had to do one?
Educate our communities about grandparent rights. All I'm told everywhere I go is grandparents don't have rights. Grandparents don't have rights. Well, we need to do something about that. If they don't have rights, if they have some rights, we need to do a better job of educating our folks out there that are trying to help others. So now that's number 2. I was going to say the financial. So yes.
I saw you snuck that one in. I like it. Chantel, will you share one thing that you want legislators to know about informal kin, and you hope that they have in the back of their mind as they make decisions this session?
Yes to everything those ladies said, but I would say a true understanding of what informal is. I still think there's so much not understood. in regards to the fact that these families cannot be licensed. They cannot qualify for licensure. They can't, they cannot get that financial support. It's not an option for them. And I think that's huge for people to understand. The kin-specific licensure is huge, and I'm a huge advocate of it, but that doesn't help informal kinship caregivers.
Thank you for making that tie as well. All right, well, I would love to give our audience an opportunity if anybody has some questions. Again, we know that, I'm hoping the terminology was helpful. I hope everything, kind of is maybe clicking a little bit more in the conversations maybe you've heard tangentially. But we've got such a wonderful panel. I want to make sure that if y'all have questions of them, you have the opportunity to ask. And I don't think I've seen any questions come up in the chat that we haven't addressed. And I would offer, if anybody wants to, if you want to come unmuted and ask your question, if you are like, nope, please don't make me do that, Carrie, you can put the question in the chat and we'll ask for you. Well, I'm going to assume everyone is thinking right now. They're trying to sort through the questions that they might have. But while we're kind of waiting, we got a little bit of time. Is there anything y'all weren't able to cover today that you wish you could expand upon? I want to just give y'all a minute here. Our panel.
I want to talk about how important the work that those navigator programs are doing, and we're doing the same thing here in San Antonio. But I think that having a place for them to call and just be supported, and just have somebody to talk to that has gone through the similar, not the same, similar situation as you have, just having that support, and like Chantel says, walking them through some of the resources that are available is just priceless, because we get so many calls on the same things. How do you apply for TANF? How do you do that? And one of the biggest things that I know we didn't mention is we didn't mention how difficult it is to navigate that application. But I always say that, there's policy and there's interpretation of policy, and there's implementation of policy. And a lot of these applications are getting denied, maybe because they don't know how to process it. That application it's a challenge. But for grandparents and kinship caregivers, I mean, last legislation, Senator Menendez passed that Senate Bill 267, where now it's open, TANF is open for kinship, where it used to be just for grandparents. And so one of the things that is very difficult that application does not have child-only TANF. And so a lot of the grandparents are getting denied because they're wanting to count their income and their resources, and they're not taking the application as child-only. That's one of the things that is a challenge also. How can we change those forms to be more user-friendly for them? And then the other thing is constant denials. Right now, the backlog for benefits is 4 months to 6 months. I mean, we talked to the USDA the beginning of the month, and they were saying it was like 90 days. And I said, we have families that haven't gotten any response in over 4 months. So those are other barriers that are really critical, because when they have all these children, and now they're just applying for $107 a month for one child, and if you have 4 children, it's $256. So it's not even 107 for each child. And then you have all this delay, or you get denied for the one-time TANF, like Chantel says, because you're over resources. I know when I got my 5 kids, I didn't have beds, and I applied for the one-time TANF, but I was denied because my car was paid off, and it was over the $1,000 resource limit. So those are the barriers, and I think it's very important to look at these children are doing without.
Thank you for bringing that up. We do have a question that's come in the chat. Hello, Erin. Do you have anything you want healthcare providers to know or understand about serving kinship families? I don't know who maybe wants to chime in and answer that one.
I didn't think of this when we were talking about everyone that helped us, but I will say, Superior Health, is one that I deal with my grandson that has the disabilities. And his caseworker has been a fabulous resource for me. And she calls me every other month, maybe it's every 3 months, and then we meet in person twice a year. And when she calls, it's usually an hour and a half phone call because we go through everything. And she's given me a lot of good resources and a lot of good recommendations. So I would say to you, thank you for what y'all do, and be cognizant and aware when you're dealing with a situation where you have a non-formal kinship and they don't know what to do. With all of the experience I've had in all the years in education and in working with nonprofits and organizations serving families, I felt so inadequate and so not knowing what to do. And so it's very important. What you do is so important. So thank you.
I would say that, and I did speak to this a little bit earlier, but that these are kids from trauma. I would like them to understand these are kids from trauma. And that's a huge, piece of the puzzle. And then, healthcare providers and mental health care providers still have a big lack of understanding in what like that temporary managing conservatorship or permanent managing conservatorship paperwork gives. Authority to that caregiver as, even more so when we have that parent authorization or authorization agreement for a non-parent, or the power of attorneys. There's a lot of lack of understanding about, can you get care for this child with those documents? And yes, they can. And so I would think that's a huge piece of the puzzle. And then really understanding, I know we've talked to healthcare providers or like MHMR organizations that get frustrated with the kinship caregiver. And sometimes the vast amount of, mental health appointments and services that these kids need. And, you're dealing with a kinship caregiver who didn't expect it, didn't plan on it. Often is elderly, again, I'm saying, and is struggling to make all of these pieces fit together. And so, grace, I guess I would want them to understand that. Just understanding the situation is huge.
Thank you, Chantel. We've got another statement and question. We've got Jeff in Senator Sparks' office. SB 593 passed last session, and that is regarding, that's more on the formal placement side, right? But it is ultimately looking at the different regulations that are put on foster parents to become licensed, right? And kind of making an assessment on that. Ultimately, it's to help folks more easily become licensed, but also, make the ongoing process a lot easier and less of a burden on licensed placements. And so we're very thankful that Senator Sparks was focused on that last session. But I do want to ask, because basically he's asking about what are some rules or regulations on kinship placement specifically that are burdensome, inefficient, and have no effect on child safety. Chantel, I'm going to ask you, because you're a former foster parent. And I know that the kinship navigators do informal and formal, right? So do you have some thoughts for Jeff in our chat?
I do, and I'm sure Mercedes does as well. But I'll say, that home study, when our caregivers have, a 2-bedroom home or, a 1 or 2 bedroom apartment, and now they're placed with their 4 grandchildren, and we're saying they're not going to pass because they don't have the adequate space for those kids. And so it would be better for them to go to a foster home. That's what we're going to say. Or it would be better for you not to get licensed and us not to support you at all financially or have eyes or connections with these children. That's ridiculous. And so I think the home study, there's a lot that could be done there in that. And I think there is a lot being worked on in that kin specific licensure. Things like living close to railroad tracks. I mean, there's just several things that you go, okay, but you know, this is grandma, and is it, are we really okay with them being there and just not licensing them? That doesn't seem to make sense. Because we'll still leave the children there, and that's the bottom line. We're still going to leave the children with grandma. And so I think the home study, there's a lot that could be changed there. And then that age, like I said, we have several kinship caregivers in their 20s that if there was some, what's the word I'm looking for? Special circumstances for licensure for those kinship caregivers. And I know that there are, Carrie, help me with the word. What's the word? There are things you can file to get that. Say that again.
Waivers?
Yes, thank you. Waivers. Why couldn't I think of that? I know there are waivers that you can file for those situations, but if that was a standard for kinship caregivers, you know, that an older sibling could be licensed in their 20s, or again, those housing waivers, those things like that, that wouldn't have to be a special circumstances, that was standard. I think that would be huge.
I see Mercedes nodding along to a lot of the things you said, Chantel, but Mercedes, do you have anything to add?
Not only on the assessments, but the process itself is very burdensome for grandparents. Just this week, I had a grandparent call me. They couldn't even get their fingerprinting started. You know, it's $38 per child per person, and there's 6 people in the home. And so they're already on a fixed income. So for just to get the license, they need to get not only the home study, but they have to pay for their own fingerprinting, their own background checks, for, you know, fire extinguishers, all of those things that are and then of course a lot of times, you know, we're told, well, they're your grandkids, you know, how much do you really want them? And you know, it's a very tough decision, and some of these grandparents are using credit cards to do that, but they have to pay them back with interest, you know. And then, you know, or they look for resources. So we were able to help this grandmother with that financial burden. But that's another thing that we need to have legislation see. How can we license grandparents easier? You know, one of James Frank, the Representative James Franks, asked me one time when I was testifying. He says, "What did you learn from those classes when I was taking classes?" And I said, the only thing I really appreciated was learning about the substance of what do you call them, the medications. I can't think of the name they call it, but you know, the
Psychotropic medication?
psychotropic medications, yes. You know, because I didn't know that my grandkids were going to need at one point to be evaluated and assessed. Like I said, 4 had ADHD and oppositional defiance. And so, you know, we don't know what we don't know, but 60 hours of training was a whole lot, you know, back then. And now I think they're a little more lenient, but it's still a big issue when they have to pay for all of these expenses. Plus getting their house up to code.
It's quite burdensome.
Yeah.
Well, thank y'all. And Jeff, I hope that was helpful information for you to have. I do want to just take a second. Can we all give a round of applause for our panelists here? I mean, y'all are excellent. I do. I thoroughly enjoy working with each of you, and I hope everyone understands why, because you guys are just so knowledgeable and have so much wisdom to share. So thank y'all very much. I'm trying to think if there was anything else. Just so you guys know, we are recording this, and so we will be following up with an email to all the registrants. And so if there's anything you want to go back and listen to or anything like that, you definitely can. Our panel, are y'all comfortable sharing y'all's emails in the chat with anybody that maybe wants to follow up with each of you? I just want to make sure that if folks have some additional questions or want to kind of dive a little bit deeper, that they can. All right, Adriana, I'm going to pass it over to you.
I'm so inspired and overwhelmed. The vulnerability of everybody to share their own personal stories and so much that they've learned through the process. Just thank you today to each of you. Would invite all of you to come back and join us for our next Building Strong Families in series. This one will be on connecting families to resources. We all know how hard it is to navigate in Texas, being able to just figure out how to connect to what you need, or how, if you're a teacher, to connect your students to what you need, or how, if you're a home visitor, to connect the families you're serving to what they need. We've got kind of a fragmented system, and so we're going to talk a little bit more about that. So we'd love for you to join us. Please spread the word. On September 26th, there is a link that I think we can put in the chat for how you can register for that, and we'll also put that in the follow-up email. So thank you again to our panelists. Thank you to everybody in the audience for being here today, and please come back and join us for our next in our series. Thank you. Bye, everybody. Have a great rest of your day.
Bye.